Hello again, class. This is Mr. Allen again, and this is medical terminology. So this lesson is going to be chapter 6, and it's on the reproductive system. So we're going to go through male and female reproduction, and I know you know what all of that is. That's not the point of this lesson. The point is to learn new medical terminology, proper words. So follow along with me with your PowerPoint, or you can just watch the video and go back and look later. So let me share my screen. Okay. Here's our objectives. You can look at those on your own. Okay, so this is just, we're going to start talking about the female reproductive system first. I don't think I have to really go through the anatomy with anybody, so I'll let you look at this on your own. More of the female anatomy. Okay, male anatomy. And look at that on your own. I'm sure there's nothing new here for anyone. Functions of the reproductive system. I mean, I don't think I have to tell you, but I can read them. Produce egg and sperm cells, secrete hormones, provide for conception and pregnancy. Pretty much it. We knew that already. Okay, let's talk about some word roots. Okay, cervix means cervix or neck. Now don't confuse this with, this can be used for the cervical as far as talking about the cervical spine, but if it's with an X, it's going to be the cervix in the female anatomy. Culp or vagin means vagina. Gynec means woman, so think of gynecology. Gynec actually means woman. Hyster or metra means uterus. Hyster or meter means uterus. Mam or mast means breast, so think of like mammary gland. Men does not mean male, it means menstruation. Metra means uterus. I think we have that one already. This is not oophore. This is oophore, means ovary. You actually say both O's separately, oophore. Salping is a word root that means uterine tube or fallopian tube. The tube that goes from the ovaries to the uterus. Orchid means testes or testicle. Prostate means prostate gland. Scrot means scrotum. Very easy. Vas means vessel or duct. And we'll learn, I'll show you a vessel that males have, which uses vas in a minute. Suffixes. Seal means hernia or protrusion. We'll make some words with that in a minute. The P is silent. This is just pronounced ptosis. This means drooping, sagging, or prolapse. So drooping or sagging or prolapse, and prolapse is when a body part actually protrudes out, starts to protrude out of the body outside of an opening. Rhexis means rupture. Okay, now female terms. Amenorrhea. Amenorrhea. So we know A means without. So this is without menstruation. Men is menstruation. Rhea is rapid flow. So we know this is without menstruation. Cervical is just referring to the cervix or to the neck. Cervicectomy is whenever they have to actually open up and remove part of the cervix. Cervicitis is just an inflammation of the cervix. Colpitis is inflammation of the vagina. Colpocystitis is inflammation of the vagina. And if you remember what cyst is, give you a second to think about it. Cyst was in the previous lecture. It means bladder. So this is an inflammation of the bladder and the vagina. Colptosis. This means sagging or drooping or protrusion of the uterus. Not uterus, vaginas, I'm sorry. Sagging, or drooping, or protruding of the vagina. Sorry about that. Colptoscope. This is a camera used to look inside the vagina. Colposcopy is the act of looking using the scope. Cystocele. Okay, so cyst is bladder or fluid-filled sac. And if you remember seal, which we just had, that means hernia or protrusion. So this is actually a hernia or protrusion of the bladder. So the bladder is actually herniating either through the skin or trying to herniate through an opening. Dysmenorrhea. So we've got dys, which means abnormal or painful. Menstruation, rhea, rapid flow. So this is painful or difficult menstruation. Gynecologist is a doctor that studies females. Gynecology is the study of females. Hysterectomy. We've heard this word a lot. Hyster means uterus. Ectomy is incision or removal. So this is removal of the uterus. I know as you'll learn here in a minute, a lot of times when women say they have a hysterectomy, sometimes they just have the uterus taken out, but sometimes they have their ovaries taken out too. And sometimes they have other things taken out. There's lots of names for those, and we'll learn all those in a minute. The hysterectomy is just the uterus is removed. Hysteropexy, so this is hyster, which is uterus. And if you remember pexy from a previous lesson, pexy means surgical fixation or surgical suspension. So this would be if they did, for whatever reason, the uterus needed fixating or put back in place, it would be surgically fixated to the body wall. Hysteroptosis. So this is actually, so hyster is drooping or sagging, and I'm sorry, I mixed it. I just gave you the answer. Ptosis is drooping or sagging. Hyster is uterus. So this is actually a drooping or sagging or protrusion or hernia of the uterus. Hysterorrhaphy. So rhaphy is rapid flow. No. Rhaphy is surgical suturing. I'm sorry. I told you in another lesson, I always mix that one up. Rhaphy is surgical suturing. So this is a suturing back together of the uterus. So maybe after a C-section, after a cesarean, they have to close the uterus back up again when they're done taking the baby out. So they suture it all back together. That's a hysterorrhaphy. Hysterorrhexis. Rhexis is rupture. So this is actually a rupture of the uterus. No good. Very dangerous. Here's a picture of a hysteroptosis where the uterus is prolapsing, and you can see by the picture, if you follow the arrows, it's supposed to be, if you start at the top, the uterus is supposed to be in that little horizontal, almost like a diagonal or almost horizontal location. But then as it starts to protrude and prolapse, it goes further and further and further down and becomes a vertical and almost starts protruding out of the outside of the body. Okay, more female words. Hysterosalpingogram. What in the world? Can you even say that? Hysterosalpingogram. Okay, let's start simple. Gram. So we know it's going to be a recording or an image. Hystero is uterus. Salping. If you remember from earlier in this lesson, salping or salpingo means fallopian tubes or or uterine tubes. So this is a picture of the uterus and the fallopian tubes. Hysterosalpingo-OOPHORECTOmy. I'm going to say that again for you. Hysterosalpingo-OOPHORECTOmy. Okay. Long word, don't freak out. We can do this. Ectomy is surgical removal or excision of. Okay, so we know something's being surgically removed. So let's start at the beginning. Hystero, we got uterus. Salpingo, we just had that, fallopian tubes. OO4, remember OO4 means ovary. So this is actually removal of all the female parts, or all the main female organs. You've got the uterus going, the ovaries going, and the fallopian tubes are going. So they take all of that out. So remember back a few slides ago, I said a hysterectomy is literally just the removal of your uterus, but sometimes women just say hysterectomy even when they mean everything's taken out, because it's just easier to say that word. Mammogram, picture of the breast. Probably all know that. Mammography, taking a picture of the breast, the machine taking it. Mammoplasty, surgical repair of the breast. Mastitis, inflammation of the breast. Here's a hysterosalpingogram, a picture of, you can see everything. You can see the vagina, you can see the cervix, you can see the uterus, you can see the fallopian tubes, and you can see, I think that's an ovary. See 1, 2. Here's a hysterectomy when everything is left except the uterus. Here's an oophorectomy where the only thing they take is the ovaries. And here's the hysterosalpingo-OOPHORECTOmy where they take everything. Mammogram. Menorrhagia, okay, rapid flow of blood during menstruation. Men is menstruation, rhagia is rapid flow of blood. So this would be like a heavy menstruation. Menorrhea. Metritis would be, metra was uterus. So this is inflammation of the uterus. Sorry, had a brain fart. Metropathy would be a disease of the uterus. Oophorectomy, removal of the egg of ovaries. I'm sorry. Oophoritis. This is inflammation of the ovaries. Oophorectomy. This is surgical fixation or repairing of the ovaries. Inflammation of the fallopian tubes. Salpingocele. Okay, cele is herniation or protrusion. Salping is fallopian tube. So this would be a protrusion or a herniation of the fallopian tubes. Referring to the vagina. This is inflammation of the vagina. Vaginomycosis. So osis is condition of, myc is fungus. So this is condition of having fungus in the vagina. Male terms, male reproductive terms. Prostatolith. So we know prostate is prostate gland, but what is lith? If you remember from the last lecture, lith is stones. So this would be actually a stone within the prostate. Scrotal just refers to the scrotum. Scrotocele, so cele is a hernia or protrusion. So this is a hernia or a protrusion of something, some organ through the scrotum. And that actually is very common in men. Scrotoplasty would be a surgical repair of the scrotum. Vasectomy. Everybody these days knows what a vasectomy is. Well, we know otomy or Tommy means opening or artificial opening. Vas is a duct or vessel. So this a vasectomy is a opening or a cut into the vessel that carries sperm from our testes into the rest of our to our prostate. So we still so men with a vasectomy will still have semen, but there will be no sperm in that, and those are reversible. Vasovasotomy. Vasovasotomy is the reversal of a vasectomy. Orchidectomy. Orchidectomy is the removal of a testis or testicle. Orchiditis is inflammation of the testis. Orchidopexy means surgical fixation of the testes. Prostatectomy is removal of the prostate gland. That's very common after having prostate surgery. I mean cancer, prostate cancer. Prostatic just refers to the prostate gland. Prostatitis means inflammation of the prostate. Prostatitis means inflammation of the prostate. Prostocystitis is inflammation of the prostate, and what does cyst mean? Means bladder. So inflammation of the prostate gland and the bladder. This is a picture of the prostate gland. It's about a walnut-shaped organ size and shape, and you can see that brown little plaster lesion and is a tumor, and that's often what prostate cancer looks like. Here's what a vasectomy looks like. And picture number 4 is what you end with. But if you want to have your vasectomy reversed, then the doctor just opens those ends back up and sews them back together. Okay, so let's go through some word terms not built from word parts. Dilation and curettage, which is also known as a DNC, means a scraping out or cleaning out of the uterus. So this is often done this often has to be done after a miscarriage or an abortion. Endometriosis, so endo is inside, meter is uterus, and osis is just condition of. So endometriosis is a condition where uterine tissue actually grows outside of the uterus in different areas of the female reproductive tract. So there will be portions of uterine tissue that grow maybe on the fallopian tubes, and then some on the ovaries, and some on the outside of the uterus, and then on other areas. So, and this can be a very painful condition, and it can cause the loss of the ability to get pregnant in women. Fibroid tumor is just a tumor of fibrous or material connective tissue or muscle. A pap smear is, I'm not even going to try to say the real name because it's so long. Well, this is a test, a gynecological test that's done usually once a year, once every so often, to just make sure that a female's reproductive system is still functioning normally and that there's nothing wrong with it. Pelvic inflammatory disease is something that can be very dangerous for women. It just happens when some of the female organs become inflamed by infection or other problem, and then it's just causing inflammation throughout the pelvis, throughout the reproductive system and urinary system. Sexually transmitted disease, you know what that is. This is a picture of endometriosis, and you can see the black little places on the illustration. Those are the uterine tissue that's growing outside of the uterus. And you can see in this particular picture, it's all over this particular person's abdomen and lower pelvis. Okay, terms not built from word parts for the male reproductive system. benign prostatic hyperplasia, long word, a long name. Well, we know what benign means from another lesson, just means not dangerous. Prostatic is referring to the prostate. Hyperplasia, we know what hyper means. It means above or excessive. Plasia just means producing or growth. So benign prostatic hyperplasia would be if the prostate is getting bigger, but then they test it, and it's not cancerous and it's not diseased. It's just getting a little bigger. Now prostatic hyperplasia does happen to a point with almost all men in older age, but if you had true BPH, benign prostatic hyperplasia, that would be a true diagnosis. You know what this is. Digital rectal examination is how prostate glands are usually first examined, and it's done by the doctor, and it's actually done by digit means finger, so it's just done with a finger. You know what this is. This is just looking PSA. A PSA is just looking for certain cancerous markers in the blood. Transurethral resection of the prostate gland. That is a long name. That is actually, and there'll be a picture of that coming up. That's whenever they actually take your prostate gland out, say if you've had cancer or if it's getting too big, but they don't cut you in your perineal area. They go through the man's urethra with a tube that has cutting instruments on the end of it that come out whenever they push a certain button, and then it basically destroys the prostate gland. This is what it looks like. So you see this long metal scope and tube going down through the urethra, and then it ends at the prostate gland, and then they're gonna activate the cutting tools, and then that will just cut the prostate gland out, and then they'll remove it through the urethra. Doesn't sound something I'd want done. Okay, we know this. You know these. Hepatitis, if you remember, HEPAT. HEPAT is liver, so that's inflammation of the liver. HPV, or human papillomavirus, is a virus that is easily spread, but it can cause cancer later on in life. And most of these are all STDs and that you are familiar with. Now the politically correct term is now sexually transmitted infections, not diseases. So now the new abbreviation is STI. I don't know why they had to change it, but they did. Abbreviations: benign prostatic hyperplasia is BPH. Digital rectal exam is DRE. DNC is dilation and curettage. Erectile dysfunction. PID is pelvic inflammatory disease. PSA is prostate specific antigen assay. That's the marker they look for in a blood test to see if you have prostate cancer. STD is sexually transmitted disease, but now it's STI. And TURP is transurethral resection of the prostate gland. Okay, let's look at a note real quick. So now in this note, we've got a 37-year-old female. Complains of fullness in the pelvic region and menorrhagia. So she's menstruating and she's having a rapid flow of blood. So she's having a heavy period. Don't see much more here. Let's go to the next page. They did a pap smear and found uterine fibroids. So uterine fibroids are like little uterine tumors. And then we discussed the benefits of having a hysterosalpingo-OOPHORECTOmy in view of the mother's history of cancer. And that's it. Okay, so we made it through another lesson. So this one was pretty, there was a lot of stuff that was very straightforward and that you knew already, but hopefully I taught you some new terms too. So some of these words are getting long, as you probably start to notice. Even with each chapter, some of them are getting longer and longer. So don't let your word roots and your prefixes and your suffixes sneak up on you. Start knowing those things for like the back of your hand. Okay, don't forget to turn in your assignment, and I will see you next time.